Hello, my name is Erica Fernandez, and in this presentation, I'm going to explore the financial and reimbursement structure of MediCal, California's Medicaid program. We'll look at how budget constraints, low provider participation, and national healthcare trends like Medicare's financial instability affect MediCal's sustainability and equity. MediCal is a lifeline for millions of Californians, especially low-income families, seniors, and individuals with disabilities. Despite its reach, the system faces serious challenges. One of the biggest issues is low reimbursement rates, which discourage provider participation and limit access to care, especially in specialty and rural services. Recent budget proposals include reinstating asset limits and restricting coverage for undocumented adults. These changes aim to preserve MediCal sustainability, but also raise ethical concerns about equity and access. California is also rolling out strategic reforms, which focus on improving care coordination and outcomes. However, these reforms require consistent funding and strong provider engagement to succeed. As a healthcare administrator, I believe we have to advocate for fair reimbursement and thoughtful policy changes to ensure MediCal remains both effective and equitable. MediCal insurance in the U.S. began with employer-sponsored plans after World War II, which helped working families access care through their jobs. In 1965, the government introduced Medicare and Medicaid, creating a safety net for older adults and low-income individuals. These programs laid the foundation for public health coverage. The Affordable Care Act marked a major turning point. It expanded Medicaid eligibility, especially for childless adults, and help reduce financial stress for millions of families. However, the COVID-19 pandemic exposed many vulnerabilities in the system. Medicare's finances were strained due to reduced payroll tax revenue and increased spending on hospitalization and testing. These historical shifts show how healthcare coverage has evolved in response to economic and social pressure. As administrators, understanding this timeline helps us anticipate future challenges and advocate for sustainable reforms. MediCal's Pay for Performance program encourages preventative care, especially in dental services. However, adult participation remains low, which reflects ongoing reimbursement challenges. From my 15 plus years of working in dental billing at Loma Linda University, I've seen firsthand how MediCal helps patients access care they otherwise couldn't afford. But I've also seen how low reimbursement rates discourage providers from participating, especially in specialties like oral surgery and care for patients with disability. The reimbursement is close to nothing, and it's very hard to try to find providers that, especially that are paid based on collections. It is very hard to try to find good providers. And this is why I chose MediCal as my focus. It's a system that touches lives every day, but it's also one that needs reform the most. Updating fee schedules and improving provider incentives could make a real difference in access and quality. As a healthcare administrator, I believe we must advocate for fair reimbursement and policies that support both providers and our patients. MediCal is jointly funded by the state and federal government, and it operates through both managed care and fee-for-service models. These models allow flexibility in how care is delivered, but they also introduce complexity in reimbursement and oversight. The program includes waiver options for specialized services such as home and community-based care, which does help tailor coverage to individuals' needs. However, these waivers require detailed documentation and coordination between providers and county offices. And as the flyer shows, MediCal is deeply integrated into California's health system. It shares an application process with Covered California, and eligibility is determined locally based on income, age, disability status, and other factors. This decentralized structure ensures flexibility and responsiveness to community needs, but it also demands strong administrative coordination to avoid delays, errors, and gaps in coverage. For healthcare administrators, understanding this structure is very important, not just for managing reimbursement, but for ensuring patients receive timely and appropriate care. MediCal provides comprehensive coverage for millions of Californians, including hospital visits, dental care, mental health services, and prescriptions. It serves a diverse population: children, seniors, individuals with disabilities, and even some undocumented residents, making it one of the most inclusive public health programs in the country. Eligibility is determined by local county offices, which assess income, assets, age, disability status, and Medicare enrollment. These offices also help applicants understand their benefits and responsibilities, ensuring that care is accessible and properly managed. As administrators, we must recognize the critical role county offices play in maintaining the integrity of the program. Their coordination affects not only access to care, but also the accuracy of claims and the efficiency of reimbursement. Understanding this structure helps us advocate for better training, clearer communication, and stronger support systems to ensure MediCal continues to serve those who need it the most. One of the biggest issues facing MediCal is low provider participation, especially among specialists and dentists. Many providers choose not to accept MediCal because the fee schedules are outdated and do not reflect the complexity or the quality of care that they are providing. At Loma Linda, we have departments like our oral surgery department and special needs care, and they struggle to maintain services under these financial constraints. The current cost-based reimbursement model adds significant administrative burden, requiring detailed documentation and subjecting providers to audits and delayed payments. These delays and complexities not only frustrate providers but also impact patient access and continuity of care. Counties and clinics face operational strain, and there are limited financial incentives for specialists to participate in MediCal, which, of course, further reduces access for vulnerable populations. The proposed transition to a fee-for-service structure could simplify payments, reduce administrative overhead, and help attract qualified providers. However, we must advocate for reimbursement reforms that support provider sustainability while ensuring patients receive timely and high-quality care. In my experience at Loma Linda, we see a lot of issues with low reimbursement and how providers are affected by this. And honestly, the quality of care. We have staff shortages. We have, claims that are being denied. We have the quality of care is not what it used to be. And I think that introducing these reforms could make a huge difference for staff shortness, for the shortage of staff, and also, again, the quality of care, and help with reimbursing our providers that deserve that. California's 25-26 budget proposes reinstating asset limits for seniors and people with disabilities and limiting coverage for undocumented adults. These changes are designed to reduce costs and preserve MediCal financial sustainability, but they raise serious ethical concerns about equity and access. The cancellation of planned provider payment increases may further discourage participation, especially in underserved areas where access is already limited. This can lead to longer wait times, reduced specialty care availability, and increased strain on emergency services. We have to be advocates for policies that balance fiscal responsibility with equitable access to care. That means supporting reforms that protect the vulnerable populations, which also ensures providers are fairly compensated. We must also consider the long-term impact of these decisions. Restricting coverage and reducing payments may save money now, but could result in higher costs later due to untreated conditions and increased reliance on emergency care. Clean claims improve efficiency, reduce administrative burden, and protects financial integrity. For example, a federal audit found that hospitals overstated device usage, resulting in nearly $18,000 in overpayment. This highlights how even small billing errors can have major financial consequences. In my experience in billing, I've seen how submitting clean claims the first time saves hours of rework and prevents denials. Collaboration between coders and billers is essential to ensure documentation supports accurate reimbursement. Incorrect claims can trigger audits and appeals, which are time-consuming and costly. Medicare's 5-step appeals process is strict, and missing deadlines often means permanent denials. Healthcare administrators have to understand these risks and ensure their teams are trained in billing accuracy. Financial literacy isn't just about reading reports, it's about preventing errors that could jeopardize reimbursement. As Gleckman 2018 explains, while Medicare may not collapse, its rising costs could reduce federal support for state programs like MediCal, forcing administrators to make difficult budget decisions. Administrators have to not only understand reimbursement mechanics, but also anticipate how national trends like Medicare funding shifts may affect local operations. Financial literacy empowers administrators to improve reports, forecast budget impacts, and advocate for sustainable reimbursement budgets. What are the possible solutions, and what direction can we take in the future? Regularly updating fee schedules not only reflects the true cost of care, but also helps retain providers who might otherwise leave MediCal due to financial strain. Streamlining administrative processes can reduce billing delays and free up resources for patient care, improving both provider satisfaction and system performance. Value-based reimbursement models reward quality outcomes, which is what we want and what we need, and it encourages providers to focus on preventative care and long-term health improvements. Public-private partnerships can bring innovation and funding to MediCal, helping the program evolve without compromising access or equity. According to BBVA 2022, nearly 1 in 4 MediCal enrollees reported delays in care. This highlights how coverage alone doesn't guarantee access. MediCal's inclusivity is a strength. Its sustainability depends on ensuring that coverage translates into timely, equitable care. Healthcare administrators need to recognize these challenges and advocate for reforms that protect both access and provider viability. As a future healthcare administrator, we have to balance patient care with financial responsibility. This means advocating for fair reimbursement, using financial reports to guide decisions, and ensuring compliance with billing regulations. Our role is to support both the organization and the patients that it serves. As someone who has worked in Loma Linda, at Loma Linda for over 15 years, I see firsthand how MediCal affects both patients and providers. While I support expanding access, I also understand the need for budget reforms to keep the system sustainable. Healthcare administrators must advocate for fair reimbursement while ensuring financial stability. In conclusion, MediCal needs strategic reforms to remain effective. We must update reimbursement structures, maintain coverage for vulnerable populations, and invest provider retention and billing accuracy. These steps will help ensure MediCal sustainability and protect access to care for those who need it the most. All my sources in this presentation are cited. It includes articles, government reports, and course material. These references support the data and insights shared throughout the presentation. I hope you enjoyed it, and I hope that you learned a little bit from my presentation as I did from this class. Thank you very much. All my sources in this presentation are cited. It includes articles, government reports, and course material. These references support the data and insights shared throughout the presentation. I hope you enjoyed it, and I hope that you learned a little bit from my presentation as I did from this class. Thank you very much.